Hi, this is Group 41's YouTube link submission. In this group, we have Courtney from the College of Medicine, Jeremiah from the College of Pharmacy, Amy from the College of Medicine, Darsho from the College of Medicine, Garis from the College of Pharmacy, and Casey from College of Pharmacy. In case number 2, my groupmates and I read a story explaining an HIV positive mother giving cesarean birth to a newborn baby boy, wanting to keep her diagnosis a secret from her partner who fathered the child. In this video, we're going to be explaining the scope of practice each healthcare provider involved and laws to follow.
So from case 2, there were a number of different professionals. We had the obstetrical provider on call that coordinates and provides the care for non-emergent C-section during after hours for the mother in case 2. We have the maternal fetal medicine clinic provider who is the primary care provider for the patient's pregnancy course. The CRNA is going to plan and deliver anesthesia, pain management, airway management, and related care to patients. And then nursing teams will administer and monitor medications, develop care plans, take vital signs, recognize abnormalities in the patient, and care for wounds. Pharmacists will dispense prescription medications, counsel patients on the safety and appropriate use of medications. Hospital risk managers are trying to reduce the number of medical malpractice claims that are filed against the hospital and also maintain low rates of employee loss. The medical malpractice defense firm provides counsel for hospitals and medical practices, surgical centers, blood banks, physicians, nurses, pharmacies, and they basically counsel them on how to handle malpractice lawsuits. And the head of Women's and Children's Services oversees day-to-day operations of healthcare facilities and focuses on the care of women and children. They ensure that the facilities run efficiently and adheres to policies of the hospital and state and federal regulations regarding healthcare. And they also oversee that the staff are implementing policies and procedures to ensure high quality healthcare.
All right, so the first key responsibility of the interprofessional team is to educate. They must understand what does the mom actually know about the risks of HIV and the long-term consequences of transmitting it to her partner and her baby. They must educate her on why the C-section is preferred versus the vaginal delivery. And finally, they must let her know that it's the MFM and obstetrician's responsibility to report to a health agency that she is HIV positive and that ultimately her partner would come to know, and they must be willing to offer kind of a joint counseling session if she would like their help in disclosing that to her partner. And also letting her know that there's no guarantee that her partner has also been infected with HIV. And then finally, safety, ensuring that the mom, the baby, and the partner are all provided the best quality of care and minimizing their risk of exposure as much as possible.
Okay, next, we wanted to cover public health implications and balancing surveillance and privacy. Public health implications include 2/3 of people living with HIV live in the sub-Saharan Africa area, like our patient. In this scenario, 38 million people were reported in 2019 of living with HIV. Despite medications, death is still one of the highest among HIV at 690,000 people dying of AIDS or related causes. 1.7 million people were newly infected with HIV in 2019. HIV remains a leading cause of death worldwide, with a total of 1.5 million people becoming newly infected in 2020. 1 in 6 people are unaware that they are living with HIV, which pertains to our case in the sense that our patient's partner does not know that she is HIV positive. There are policies that also discriminate against vulnerable populations, which makes it difficult to deliver HIV services to them. Also, we want to prevent mother-to-child transmission. There are over 483,000 women in 2020 that we're trying to reduce HIV risk for the newborns in. The breastfeeding. Education is important. It is not safe to breastfeed mothers who are infected with HIV to their newborns. This can increase the transmission of infants to infants. Some physicians will tell patients that treatment of ART can lower their maternal viral load and it is safe to breastfeed. However, the American Pediatric Association disagrees with that. Surveillance is the true value of surveillance is measured by its impact on public health action and practice. Public health agencies at all levels have broad authority to collect, store, and use personal health information to identify, report, and control health threats, and to plan, implement, and evaluate public health programs and services. With that being said, all of the resources that I found from the CDC say that the difference between surveillance and privacy, or surveillance versus privacy, is that you surveil the data, you do not release any HIPAA related information. So when reporting, there's no patient identifiable information that gets sent. There is certain states that do require you report both positive testing and laboratory testing, as well as certain states in the United States that require reporting to the patient reporting positive test results to their partner. However, Texas is only a general law state.
And yeah, so one of the questions we did want to kind of look at regarding our case is what are the actual Texas laws governing perinatal HIV testing? So as Courtney mentioned, Texas is one of those states that does require reporting of any case of HIV and AIDS as part of Title 25, Part 1, Chapter 97, Subchapter F. And then the CDC actually has a nice infographic available on their website based on some 2006 data that just shows the different levels of whether testing prior to third trimester or testing for any time during pregnancy on which states have different laws and regulations. But according to the Texas Department of Safety and Health, Texas law is does require physicians and others permitted by law to actually test for not just HIV, but syphilis and hepatitis B as well in the first prenatal visit. And they also had to be retested during the third trimester again. And so another caveat to that is that expedited delivery of an HIV test needs to also be performed if there is unknown record of HIV testing prior to that.
As to a scenario where how should the health professionals in this scenario respond if the husband asks what the medication is for? Overall, specifically in Texas, there is a partner notification law that just informs the patient of their obligation to inform their partners. However, despite the vast responsibilities that these health professionals have towards the patient, none of them include informing the partner, and thus they must require the laws of HIPAA, and they cannot disclose any information that the patient does not want shared to her partner. And so overall, they can just say it's post-surgical care or for a therapy of some sort. However, they must be consistent with the laws of HIPAA.
Okay, so this was the work for us for Group 41. These are our wrap-up questions for case number 2 for the HIV scenario.